of ankle and foot rules. An ankle x-ray is indicated if they have pain in the malleolar zone, as well as have pain or point tenderness on the medial malleoli or the lateral malleoli, and cannot bear weight in the emergency department or immediately right after the injury. Foot x-rays are indicated for the same only if the pain or point tenderness is on the base of the fifth or over the navicular. Okay, I'll be doing the TIC for a patient who may respond to spinal stabilization. So there's a couple things to look for. The first is if the patient is less than 40 years old. Check. If they display aberrant movement, I'm going to have you face this way. Go ahead and bend over, touch your toes. So aberrant movement would be displayed there. Okay, you can come back up. Next would be a positive prone instability test. I'm going to have you on your belly. So I would PA. If that was painful, I would have her come off the edge. Find the same segment, PA, press down, go ahead and lift your legs up. That should not be as painful. You can go ahead and stand up and lay on your back. And next would be the straight leg raise test. So I'm raising the leg up, greater than 91 degrees, and that would be the TIC. Okay, I'll be doing the TIC for those who would respond to spinal manipulation. First of all, there's 5 things. First, non-radiating acute low back pain. Acute onset of less than 16 days, an FABQW score of less than 18, hip internal rotation of at least 35 degrees on one hip. Go ahead and internally rotate. Yep. And hypomobile PAs. Can you lay on your stomach for me? That's all. Demonstrating McMurray's test. Okay, today I'll be demonstrating the Lockman's test. Okay, today I'll be performing the straight leg raise test or the neural tension test of the lower extremity. I'm going to passively raise her leg up. If it's more than 30 degrees, typically is okay. If it's less than 30 degrees, that would be a positive. If I get her to a certain point and she feels the numbness and tingling symptoms that replicate her pain, I can dorsiflex the foot and see if that increases the pain or makes it a lot worse. Okay, today I'll be demonstrating the TIC for hip OA. First of all, they self-report that squatting is an aggravating factor. Secondly, they have lateral hip pain with active hip flexion and supine. Can you go ahead and lay on your back? Go ahead and bring that knee to your chest. And it should hurt on the outside. A scour test causes that lateral hip pain or groin pain as well. They have active hip extension causing pain. Can you roll over on your belly? Go ahead and extend that leg. Yep, that's a lot of extension there. And then they have passive internal rotation of less than or equal to 25 degrees here. Go ahead and internally rotate. Perfect. And that's the TIC for hip OA. Today I will be demonstrating the anterior drawer test. Okay, today I'll be demonstrating Thessaly's test. Differential diagnosis of a gluteal or hamstring weakness with either an L5 or S1 radiculopathy. So the hamstring or gluteal weakness will just present purely as that. If it is either an L5 or S1 radiculopathy, there's 3 other things to look for. The first being a dermatomal pattern deficit. So this deficit would be present either as the impaired sharp dull or touch no touch sensation, and it would be present on the lateral lower leg, the lateral and bottom part of the foot, as well as the middle and lateral aspect of the posterior lower leg and the upper leg or the normal leg as well. So in addition to the dermatome, there would also be a deficit in the reflex. So your L4, L5 patellar reflex could be diminished when compared bilaterally, as well as the S1 Achilles reflex when compared bilaterally. So those would be present as well.
And then the third thing is, in addition to the gluteal and hamstring weakness, you're going to have other muscle weaknesses that come into play as well, because there's many more muscles than just the glutes and the hamstrings that are innervated by the L5S1 nerve roots. So some of those things to look for are on the ipsilateral side. You're going to see, do they have proficient dorsiflexor strength, plantar flexors, the ankle everters and inverters, as well as the hip abductors and the hip extensors. So being able to check all the other muscles involved by the nerve root, as well as the dermatome and the reflex, is the biggest way to differentiate just pure gluteal or hamstring weakness, which you can MMT, versus all the other signs and symptoms that come with a L5S1 radiculopathy.
Oh, I can't see my head. Today I'll be forming. Today I'll be. Your foot. Today I'll be demonstrating the posterior drawer test.
No, those are enough. That doesn't mean they're wrong. She just highlights like the main points.
Okay, Ottawa ankle rules. If they have any pain or tenderness over the medial malleoli or over the lateral malleoli. Darn it.
Those who would respond to
The DIC. Bless it.
at least. I said
So close, but so far.
I even said the right words.
You did. You did say the right words.
I was so focused on active hip flexion.
You were so focused. You were so focused. Where's Magoni?
Okay, today I'll be demonstrating the TIC for hip OA. First, they have a self-report squat. They self-report.
They squat. I'm just gonna start it over.
Okay, that's a blooper.
Okay.
Okay, so today I'll be demonstrating the TIC for hip OA. First, they have a self-reported squatting as an aggravated factor. That doesn't make sense.
How does it make sense?
Self-reported squatting.
I don't get it.
Self-report. So they self-report that squatting.
It's hard for them. It like aggravates it.
Yeah.
So they self-report.
Back pain. If they have an acute onset of less than 16 days, and those who are hypermobile with hypo.
Gosh.